So today we are going to be looking at some language for the OET writing subtest. We're going to have a look at a little bit of grammar, and we're also going to look at how to make the most of your own writing, any feedback that you get, and also the sample letters that OET use. And if you're studying with a school, or even if you're studying by yourself, hopefully this lesson will help you to make the most of all of the materials that you have to work with. So the writing is what we're looking at, and as you know, the writing is for specific professions. That means if you are a doctor, then you will get medicine case notes in your letter. If you're a nurse, you'll get nursing case notes, and so on. And in today's lesson, we're going to look at some synonyms and do a bit of revision and practice with those. We're going to go over some prepositions. We'll look at articles, that is a and the zero article. We're going to look at how to use sample letters, as I mentioned, and also how to improve yourself and improve your own work. So let's start with synonyms. Now, I'm going to give you a little bit of time to have a look at the words here. We've got uncomfortable, discomfort, complete, total. And for each line, I want you to think which word is better for an OET letter. Please remember, as always, that you can type your answers in the chat on Facebook, and any questions that you have, you can also put them there, and my colleague is there who will be able to answer the questions for you. Now, you might have thought, what is this question? What is Beth asking us? And the answer to this task that I've got before me and before you is that none of them are better or worse than any of the others, because it always depends on the situation. So it is a little bit of a trick question, sorry. So you've always got to think, who are you writing to? Because that is going to help you to know which kind of language is better to use. Imagine that you are a GP and you're writing to a consultant, then maybe the word gastric will be better than stomach. But if maybe you're a nurse and you're writing to a care home manager, then maybe stomach is the better word to use. So it will always depend on who you're writing to. And are they a medical professional or not? It might be that you decide to use technical language because you're writing to a medical professional, or you might want to use more layman's terms if it's someone else. Maybe you're writing to the husband or wife of a patient or something like that. And you need to think about, with that person you're writing to, what's their relationship to the patient? Do they know them or not? Because again, that might influence your language. And what is written in the case notes? If, for example, it says in the case notes that the patient is active, then you might choose to describe the patient in your letter as fit and healthy, just so that you're not repeating the word active. So it's always going to depend on your letter, on your case notes, who you're writing to. And the reason that synonyms is something good to use is basically because by knowing a range of synonyms, it's going to increase your range of vocabulary. It will help you in the exam to recall things, recall words more easily. And that means that you'll be quicker at writing. And it all just comes down to practice. Now, if you want to practice learning synonyms, you might be thinking, well, how do I find synonyms? And one of those ways is to use a book called a thesaurus. So you can buy dictionaries and thesauruses. And a thesaurus sounds like a dinosaur, but it's not. It's a really good book that has synonyms inside it, so it's worth either going online or buying one of those. Now let's have a look at some prepositions. Here you have some sentences. I've got some prepositions at the top for you, but you also need to add in another word, probably a verb. And I'm going to give you 2 minutes to do this. Again, type your answers into the chat. Okay, not an easy task, I don't think. So let's go through these answers. Some of the answers here, you might have something different and it might be correct. But the answers that I'm going to give you are most likely the best options. So with the first one, she has suffered from headaches for the past 3 years. So we always put suffer with from. And you can use this with a variety of conditions. However, it is best if you use suffer from if it is something that someone actually gets physical pain from, if they actually suffer. So, for example, if it's something that doesn't actually cause them any pain, but they have an illness, then you're best not using suffer from and you can use something different. For B, we've got specializes in. So always those two need to come together. The next one is carried out, which is quite a nice phrasal verb to use in the exam and in the letter, especially if you're talking about a test, like an MRI was carried out, or in here, an endoscopy was carried out. For D, it's by. So the pain was made worse by deep breaths and coughing. And that is just because this sentence is a passive. So it's that the deep breaths and the coughing made the pain worse. But we've moved everything around because this is a passive sentence, which just makes it more formal and it sounds more professional to use the passive. With our next one, diagnosed with, again, they always need to come together. Someone is diagnosed with something. Discharged into. Now, with the sentence, Miss Bhagwan is being discharged today into the care of her wife. Now, with this and discharged into, it is quite common. You'll see it in a lot of the sample letters. And the time that this will be most used is obviously going to be a discharge letter. So it's quite nice language here to use if you're a discharge letter and the person is being discharged into someone else's care. With G, it's to, because damage has been caused to her lungs. So we've got the damage and cause to, which need to come together. We've got complaining of, again, this is another verb and preposition, collocation, so complaining of something. And complain of is not a negative thing. It sounds quite negative, like, oh, someone's complaining again. But this is quite a medical term, so it's not a problem to use it if a person complains of something. It's not an issue. And our final one, it's a little bit different to the others, but it's on examination. And this is a really nice, concise way of saying, I have examined, or someone has examined the patient and this was the result. So all it needs is on examination and then a comma and then what was the results. I hope that was some good revision for you. It's a really good idea if you are doing the OET or studying for it that you have some kind of notebook and just make a note of these kind of phrases, because you never know when you're going to need them. And I wouldn't suggest that you take these and try and use them in every letter, but you need to have a wide range of vocabulary so that, as I said before, you can pick and choose what you think is going to be best for your letter and the specific case notes, because they're not always going to be relevant. Okay, we're going to have a look at articles now. So when you use a noun for the first time, you haven't mentioned it before, that is when you need to use a or an. So in this instance, I saw a new patient this morning. The patient was in a lot of pain. And the reason now that we're using the is because I've already told you about the patient. It was this one. I saw a new patient this morning. The patient was in pain. But if we're talking about something in general, we don't use the article. So here we've got ibuprofen is more effective than paracetamol for reducing swelling. So you're not talking about a specific paracetamol. That would be a paracetamol or the paracetamol. So for example, I might say, do you have a paracetamol? I have a headache. And then maybe they leave it on the side and they say, oh, did you see the paracetamol? It's on the side. And they go, yeah, I've got it. But in this sentence here, it's that you're talking about ibuprofen and paracetamol in general. And that means that we don't use the article for it. So let's look at this in more detail. We use a and an with what we call singular countable nouns. And what that basically means is countable means you can count it. For example, a patient, 2 patients, 3 patients. So I can count that. An example of something that is uncountable would be water. I can say water, but I can't say 2 waters, 3 waters. Then I need to say a glass of water or something like that. So with a and an, we use it for the first time that we mention something, such as in the sentence here, an appointment with a physiotherapist has been arranged. If we want to say what something is, something specific, like this is a phone, this is a mug, we've got an example here. He can ambulate with the help of a walking stick. If we're mentioning somebody's job or what someone does, then we can use a or an. Here we can see Lara, a 35-year-old builder, was recently diagnosed with asthma. If you want to start your letter with this, which a lot of people do, and you want to say the profession, which gives it a quite nice personal touch, it makes the person or the patient feel human. So it's quite nice to use their job sometimes. but remember you must use the a or an. And then we also use a or an to show the frequency, like if we say once a week or twice a week or something like that. So let's have a look at the. We use it when we talk about something that we have already mentioned or already spoken about. The patient was in a lot of pain. If it's obvious what we're talking about, then we also use the. So, for example, the ward is short-staffed, or maybe the result showed. You might be thinking, what result? But maybe it's obvious which one you're talking about. So we use the. If it's a result, you'd be like, which result are you talking about? Which specific result? But if it's the result, then you know which one it is. If there's only one of something, we can use the. So here we can see the brain is powerful. Another good example, not really related to OET, but is if you talk about the sun. So, oh, the sun is bright today. We use the because there is only one, at least in our area. With superlatives, so if you're talking about the best, the biggest, the tallest, and also with ordinal numbers. So this is very important. For example, on the first visit, on the second visit, something like this, which a lot of students I found tend to use, which is a very good way of ordering chronologically the visits. You need to use the, so on the first visit. Another option for that is to use the pronoun his or her. So for example, on her first visit, she presented with blah, blah, blah. And let's have a look at the zero article. Now, the zero article means nothing at all. We don't say a, an, or the. We have nothing at all. So with the first one, if you are speaking in general, as we said before, ibuprofen has been given to reduce the swelling. I'm not talking about a specific pill. I'm talking about the general medication. So ibuprofen has been given. Now, we also don't use anything before meals. So we don't say the breakfast, we just say breakfast. We put nothing before days. The example here, Mrs. Nelson presented last Tuesday complaining of fatigue. So it's not the last Tuesday, it's just Tuesday. And also with months. So maybe Mrs. Nelson first presented in February. It's not a February, the February, just in February. With some nouns, we don't use an article. Again, not really related to OET too much. However, it might be that the patient has a specific profession and you might need to mention a place. So school, church, home, work, none of these have the or a before them. And with next and last, we don't use a, an, or the. His knee was operated on last week. His knee is to be operated on next week. So we can just change that for the future, is to be operated on next week. But again, we're not saying the next week, it's just next week. With place names, it might be that you have case notes where the patient speaks very little English, and you might need to say, you know, the patient originally comes from China and has a limited level of English or something like that. I have seen that in case notes before. So yeah, with place names, we don't use anything. And also the names of institutions. So if you're talking about the specific name of a hospital, we all know with OET, there's a lot of Newtown General Hospital. So no, the, a, or an there. And a few more specifically related, hopefully for you and for OET, with subjects like cardiology, biology, medicine, nursing, we don't use a, an, or the. With procedures and tests, we use a or an. So an operation, an MRI, a CT scan, an X-ray. They all need a or an. For example, you might say, an X-ray was carried out. Make sure it's an X-ray. There are some uncountable nouns, specifically for medicine, where we use the zero article. So you can't say a blood pressure. You can't say a medicine. You wouldn't use anything before those. And then with medication, we normally don't use anything. So again, we just talk about paracetamol, aspirin, metformin. This is all general. Again, it's not an a, an, or the. So we need to do a little exercise with this. I'm going to bring up some sentences, and I want you to choose whether you think it's a, an, or the. You will have 30 seconds for these. And I've got some more coming up now. Here's another 6. Again, I'll give you 30 seconds. Okay, I hope that was enough time for you. It's a bit of a challenge, it's quite quick. Let's have a look through the answers then. So number 1, the patient is still recovering. If we say our patient is still recovering, sounds a bit strange, because while we are saying this, it's obvious who the patient is because of the word still. It means they were recovering in the past and they are still recovering now. So we already know who the person is. So that means it's the second or probably third, fourth, fifth time that we're hearing of this. Now remember, with superlatives, we need to use the, so the best thing. And we have to say at this time. We can't say the this, a this, and this. Before this and that, we have to use the zero article. The medical team here in this hospital is excellent. And the reason for this is that it's a specific medical team in the hospital. So we know who the medical team are. It's not a medical team, because that would be any medical team, maybe in the world, but this is the medical team that are here in this hospital. The patient reports having the measles. Now with measles, we always have the before it, but with headaches, we don't. It's a good idea to go through lists of illnesses, diseases, problems that people have and find out whether it's with the or not, because sometimes things are with the and sometimes they're not. So here is an example. We've got liver cancer, and with cancer, we don't use a, an, or the same as with headaches. Having a cold, so we do say a cold. It is a countable noun. I should mention back at number 4, headaches is countable. And the reason there's no article here is just because it's in the plural. So you can say a headache or 2 headaches. let's look at number 7. So you need to cut down on sugary foods as they're exacerbating the pimples on your face. Now, in this case, it's the pimples because we know which pimples the person is talking about. It's obvious. It's the ones on your face. Harry has terrible acne and is using a soap which his doctor has recommended. Now, the reason that this is a soap is it's because it's the first time that we're hearing about it. But you'll notice that in the next one it says the soap seems to be helping. And the reason it's the soap is because if we refer back, we can see this was a soap before. With number 9, studies at Oxford University. Remember we said with institutions like schools and universities, we don't use any article. West London Hospital is always open. The reason there's no article here is because it's a specific hospital, a specific name. Remember we said Newtown General Hospital. There's no article before it. The hospital was very busy. And this is specific because we know the hospital. So what might happen is maybe you come home from work and your husband or wife maybe says, "How was your day?" You say, "The hospital was very busy." And the reason you're saying the hospital is because the person you're talking to knows which hospital you're talking about. But here we've got a general statement. Hospitals are generally quite busy. So that's why there's no article here. Now, with articles, it's something that students very often have problems with, and they find it difficult to know the reasons why. And that's the reason that we have just gone through that and gone through the rules again, so that hopefully when you have your writing in front of you, you can go through it and check with all of them. Okay, I've put a, is it correct? Go through it and double check that it's right. Think, have I already mentioned it? Is it obvious what I'm talking about? And hopefully that will help you to improve. The more you know about this kind of grammar stuff, the better you're going to be in the exam and the less pressure you put yourself under. Preparation is key. Now let's move on to using sample letters. Now, I think that the sample letters that OET provide and that maybe your school provides, for example, we give sample letters out here at the school, I think they're so important and there's so much that you can learn from them. Because what you can do is go through and highlight any language that you think maybe you would like to use in the future in your own letters. So with a sample letter, what I do, I get a printed copy, I get my highlighter, and I go through and I mark anything that I think I could use in an OET letter for a different situation. So I'm not highlighting specific information like names, but I'm highlighting phrases like on examination. So I think, that's good language. I can use that in future. And as I mentioned before, it's a really good idea to have a notebook. And for any useful language that you see, just jot it down, just write it down. And then you can keep revising it. If you're on the bus or something, get your notebook out, get your phone out, and go through all of this language just to get it in your head so that on exam day, everything is much easier. So I have an example of a letter here, a sample letter, and I'm going to give you about 2 minutes to go through, and you can type in the comments or write down anything that you think is good language that you could use in your own writing. Okay. So hopefully you've managed to note down some good language from this. I'm going to go through and show you what I would highlight if I was a student. So the first one for me would be a definitive diagnosis. I think this is really nice and you can use it in many different places. And very often in OET, sorry, ambulance going past. Very often with OET, it's that you can provide a provisional diagnosis, but the reason you're writing is maybe for a definitive diagnosis. So it's good vocabulary to use. Initial assessments suggest. I would note this down as well. I think it's nice to say initial assessments. It's a good collocation instead of using something like on the first assessment. The word initial just sounds a bit more formal and a little bit more professional. And the word suggest is a little bit better than maybe something like show. You could use revealed or something like that instead, and that would be good as well. As well as, it's a very small thing, but I might think, okay, that's good. I don't want to use and in my letter. So as well as, it's just something, a nice alternative to use. Okay, I like this bit. We're only remarkable in that. And the reason that this is good is because it's very concise. And in the writing criteria, there is a section for conciseness and clarity. And what happens is sometimes you'll get your case notes and you'll find that all of this stuff was nothing special. Maybe someone stayed in hospital, they had no problems at all, but they need a little bit of help now that they are being discharged home. So in this case, if everything in hospital went well, you can use this language was only remarkable in that to show maybe the one thing that stood out, but just to say that everything else went well. I also like slightly elevated. It's a really nice adjective collocation, adjective verb, just to show that it was slightly higher. And instead of saying higher, elevated is more nice language to use for that. Up until now, I would highlight as well, it's good to show about timing, both of which have been unsuccessful. So obviously you could change the adjective here. You might say successful, both of which have been successful or something like that. But it's a nice relative pronoun, you know, prepositional relative clause of which, both of which is nice. And owing to, you might write, his anxiety is very high because of his condition. But because of, it's okay, but it's quite simple. And if you just change that to an owing to, it immediately heightens your level of language. It's going to make you sound more professional, more formal, and that is ultimately going to help you get more marks in the exam. Okay, I've got another one. Again, I'm going to give you 2 minutes to go through and highlight any language that you think is useful. Okay, again, let's go through it. So I've got who has been provisionally diagnosed with. Remember before we had a definitive diagnosis. So what's happened here? Obviously it's different because this is provisional. You could say a provisional diagnosis, but what's nice is just to change that part of speech. So instead of diagnosed, we've got diagnosis, and that sort of thing really helps you to have a variety of language. So I would write that down, provisionally diagnosed or a provisional diagnosis. I also like this use of the verb noted. So noted basically just means written down, like I made a note of it. So examples of memory loss had been noted, which is a good vocabulary. Upon assessment, another word for timing, just something similar actually to on examination. So it's that, you know, when I did or when we did the assessment, but it's a much quicker and more concise way of writing that. This is lovely, this verb adhere. So did not adhere to his medication regime. And the word adhere just means like stick to. But if you say he didn't stick to his medication, it doesn't sound, it sounds a little bit informal. So by not adhering to his medication regime, it really helps you to increase the level of vocabulary that you're using. And also the onset. So instead of saying like the start or the beginning, the onset is a much more professional word to use. And finally, deemed satisfactory. So this basically means they were thought to be satisfactory or they were good enough, but it's a much more formal way of writing that. They were deemed satisfactory. Okay, one more, you've got 2 minutes. Okay, so for me, the word following is something I liked. Mrs. Buckley is being referred to following a total right knee replacement. And it's basically a more concise way of saying after having or after undergoing a total right knee replacement, but it just makes it more concise. Remember, the word count is between 180 and 200. It's not very long. So anything you can use to make yourself clear and concise is going to help you. Making a good recovery is quite simple, but it's just a nice collocation. I mean, you could change it and say the patient is recovering well, and that would work just as well. But with make, that's the verb. With recovery, that's a noun, and it's quite a nice common collocation. Perform mild exercises. Perform exercises is maybe slightly higher level language than doing exercises. If we say has been able to do mild exercises, it just doesn't sound as good. Is able to ambulate. So yeah, I would write that down. Okay, instead of can walk, is able to ambulate, just sounds better. She is to be reviewed in 2 weeks. Now, this is a passive infinitive, and it's showing the future. So instead of saying something like she will be reviewed, if you say she is to be reviewed, it really heightens your level of formality. And that's going to get you marks in the marking criteria in the section called genre and style. And that's something worth noting for all of this, is that while I'm using these words, you know, professional, formal, clinical, it's going to help you in a lot of the writing criteria, because it needs to sound like a real letter from a medical professional to somebody. And I've also got, I would be grateful if you could assess. Now, just using I would be grateful is going to make you sound polite and kind and patient-centered, which is important. And I would also write down undergo. I like this this verb. I think it's very good for OET, and it basically just means do, like do a test. But if you undergo a test, it adds marks basically to your letter. This is the last one, so 2 minutes. Okay, there's maybe not as much here, but let's just have a bit of a look. So we've got who requires an assessment. Again, it's a nice verb noun collocation to require an assessment. Instead of using the word need, require is a little bit more formal. Despite, you might see this word and think, oh, I don't really know how to use it, or maybe you're not quite using it correctly. It can be quite difficult to use sometimes, so really make sure that you know the best way to use this. But it is a really good linker to use in your writing, because it does link clauses nicely together to show a contrast. Has shown signs of, is quite nice. Again, that can be used in many different situations. So any kind of case notes, there's probably somewhere you can sneak in something like has shown signs of, or was showing signs of, or something like that. Should he not? Now this is lovely. You know, well, it's not lovely. Falling into a depression, should he not return to work soon? And this is a conditional. Instead of saying, if he does not return to work, that's basically exactly what it means. Mr. Staples has shown signs of falling into a depression if he does not return to work soon. By changing that to a should, it's made it shorter, it's made it very clear, it's made it more formal. So again, you're getting marks in conciseness and clarity and in genre and style. So again, high level language, use it as much as you can, write it down. And be careful, because this should, it is the same as the should for giving advice. For example, if I say, you should save money, it's the same word, but it is used in a different way, and it just means if. Okay, so the final thing that we're going to do today is think about how you can improve yourself and your own work. And what you might have at home are some different letters that you've done. Maybe you gave them to a teacher and they marked it for you, and they've been sitting in the cupboard for a month, and you think, well, they've already been marked. What can I do? Well, what you can do is improve yourself. So we're going to have a look at 2 letters, and I want you to see what you think. Again, write in the comments, what's your opinion on letter number 1? I'll give you about a minute to read through this. Okay, so hopefully you've read that and you've thought, okay, maybe this is quite good, or maybe not. There are no grammatical errors in this. There aren't any actual problems with language here. But let's now have a look at letter 2, and you can compare it. It's the same letter, but it's just worded slightly differently. So again, I'll give you a minute or so to read through this. Hopefully you will agree with me that letter 2 is better. It's more formal, it's more professional, and it's more concise. And what we're going to do is just have a look at this sentence by sentence to really analyze, why is letter 2 better? So here is the first paragraph of both letters side by side. And we'll start at the beginning. So what we've got in letter 1 is with right-sided chest pain. And instead of with in letter 2, they've used complaining of, which again, as we said before, is that verb and preposition, and it shows a range of language. So that is the reason why letter 2 for that bit sounds a little bit better. It's just that verb and preposition there. We've also got trouble breathing, which is okay, but you would be better with the word in letter 2, especially if you're writing to a medical professional, although it's true that we don't know that. So if you're writing, for example, to a GP or a specialist, then you can write the word in letter 2. But if you're writing to someone else, like a parent, someone in a care home, someone like that, then trouble breathing would be the best word to use. And in letter 1, they've got which began while she was having. But on letter 2, we've just got while having. And this is what we call a reduced relative clause. We've removed the relative pronoun which, and we've taken the she was, we've just made it while having a bath. And this makes it more concise, which again is going to give you marks in the conciseness and clarity part. Slightly shorter as well, that bit. We've got made the pain worse or was made worse by. So in letter 2, the sentence is in the passive, and the passive always will make your writing sound more professional. And the reason for that is it sounds more indirect because we change our subject. So we've got the verb be and the past participle made, so was made worse. And then we still got the agent who did the action, or in this case, what did the action, which was deep breaths and coughing. So we've got the shortness of breath started 4 hours before she arrived and continued until. And this kind of sounds good until you look at letter 2, where you see persisted, meaning continued. And then we've got over the 4 hours from its onset, so from the beginning to her arrival. So from letter 2, you can see that that language is much more formal. By using persist and onset, it sounds more professional. And then looking at our final paragraph, instead of not any, we've got no, which is more concise. There was no relevant past medical history. And instead of 2 weeks before, we've got 2 weeks previously. Again, this is why I'm saying synonyms are your friend. Synonyms are important. If you know that before and previously can both be used, go for previously because it's more formal. If we look at the second paragraph, we've got one of my favorites, on examination, which is short, only the 2 words, is very concise. So you can use that instead of when she was examined. And if you have writing at home and you've got something like letter 1, go through your own writing and cross things out, put something different, just to try and make it more professional, more concise, make it clearer. Anything that you're doing, you can make better using higher level vocabulary and grammar. If we have a look at the next paragraph, again, we've got the passive used, expansion was reduced, and the reason was reduced because of the pain, rather than the pain reduced her expansion. In this case, the passive is better because it's the expansion being reduced that is very important. Of course, the pain is slightly important, but the expansion is the main thing that we want the reader, the recipient, to focus on. We've got posteriorly instead of at the back, which again is higher level language, so it makes it more professional. And finally, a formal collocation. So instead of unusual, we've got abnormality. And instead of found, we've got detected. Again, with a notebook, copy down as much as you can. And this video and all of our OET videos are available either on YouTube, on our site. If you just put West London English School into YouTube, our videos will come up. but we've also got a lot of videos on the Facebook Live page. Go through them again and write down any examples of good language that you can see and that you can use yourself in your own letters. So just to summarize today, use synonyms, use a thesaurus to try and find new ways of writing. Synonyms will always help you with OET, and not just with writing. They are used everywhere in the reading as well. It's important for speaking. What you have on your role play card, you should not be reading. So you're going to need to see a word there and think of a synonym. So synonyms are so important in OET. Double check your prepositions. If you've written the word specializes, you need to put specializes in. And you can practice this yourself. Write a list of verbs and then match the prepositions with them and just go over them and make sure you know them, because they're tiny things and you don't want to fall down or have your marks lowered because you've got some prepositions wrong. Go through your letter at the end, proofread it, and check every single a, an, and the. I say this to students all the time. It's really important that you go through and double check them, because again, it's something that a lot of people have difficulty with. Use the sample letters. There are many sample letters, I think 3 or 4 for each profession on the OET website. So go to the OET website, look for the papers and download the sample letters. Obviously take the case notes and try the letters yourself as well. If you do any of our courses here at the school, every time you do a piece of writing, you will be given your feedback, but also a sample letter, and use that, make the most of it. Review your own letters. As I was saying, any letters you have, go through them and see if you can change something, cross it out and write something better. Always be improving yourself. And proofread. I remember my teachers telling me this when I was in school and I didn't listen, and I should have done. When you've done your piece of writing, go back over it and read it through. There are always going to be small mistakes that you miss. So go through and please proofread it. So that's everything from me today. I just want to tell you a little bit about the courses that we have here at West London English School. So we do have an online writing course that includes video lessons where you will see teachers, mostly myself and Harmy, who you've probably seen on OET Live before. So we do video lessons there. You get a lot of grammar practice, vocabulary practice, and then you get 5 tests. You get the case notes, send them to us, we mark it for you, and then give you the feedback and the sample letters with that. If you don't want the video lessons, you can take our writing correction service, where you don't get any of the online videos, but you do still receive the case notes, write your letter, and we'll still give you the feedback and the sample letter. It's a really popular option. We're doing a lot of the writing correction service at the school at the moment. We have a reading course, which, like the writing, has video lessons, and then there are mock tests that you can do. So if it's reading is something that you particularly struggle with, then this would be a good course for you to do. Just gives you techniques like skimming and scanning and that sort of thing to really help you get better at reading. We have the same with the listening course. It's got video lessons and again, practice tests with feedback. So why those answers are right or wrong. And we have speaking, where you get video lessons and then you get actual live practice with a teacher. And what we'll do is we will come online, speak with you, give you role play cards, practice the role play, and give you pointers and feedback on how you can improve your speaking. We also have complete online packages. So we have our platinum, gold, and our silver. The platinum includes absolutely everything that you need. It's got mock tests, video lessons, you get free live classes every week. Whereas the Silver, you don't get any lessons, but you do get practice tests. This is our team. We've got Harmy there, who is our head of OET. You've probably seen him before, either on our YouTube channel or on Facebook Live. There I am in the middle. I'm Assistant Director of Studies at the school. And we've got Catalin there, who you can say hello to because she is answering your comments on Facebook right now. But she is an OET exam speaking interlocutor. So she's also a great person to work with here at the school. So if you're in London, come in and see us. It would be great to meet more candidates for the OET exam. You can always send us an email. Our email address is oet@wles.net. The same for our website, it's www.wles.net. And as I said, we are on Facebook, we're on Instagram, we're on YouTube. So do follow us, and there's a lot more content out there for you from us. So I hope that you found this lesson useful. You will have Harmy giving you a lesson, I think, next week. So thanks for watching, and yeah, see you soon.